So the focus of today's talk and kind of taking charge through both wellness and therapy, we want you to get well, we want you to be well, and we want to stay well. So depending on where you're at any given time or where our residents are at any given time, one or two or all of these things may apply. So getting well refers to services offered through Jordan River Health Campus, and therapy services like OT, PT, and speech, the goals of which would be to promote healing and recovery. Being well, referring to the services offered through outpatient and home health therapy, like what you might find when you live at the garden homes, townhomes, or even Ruth's Way. And then staying well, referring to the wellness programs and continuing with whatever goals were achieved while someone's on therapy or home health services. And the farms refers to, that return on life, which means getting the most out of every day, which is awesome. And I think that kind of rings true and coincides with that staying active philosophy, which we'll talk a lot about when we get really into the bread and butter of the wellness component of today's talk. So that concept ties in really nicely also with what we refer to as the care continuum. All of the different departments within the farms work together with kind of one goal in mind, which is helping you take charge and thrive in place. So as you can see from this graphic here, all the different departments, wellness, therapy, home health, work together and kind of have a cyclical relationship. So we may conduct a senior fitness test or a risk assessment, for example, to identify a need of a resident. So let's say that need is maybe outpatient therapy. The resident would go on to therapy, meet their goals, and complete their treatments. Then they can be discharged onto a wellness program. Wellness would continue working with the resident to maintain what was achieved on therapy, as well as maybe any new goals. If the resident had a change in function, that cycle could repeat itself. So it's not a linear relationship. It keeps going and that cycle keeps repeating. And it maybe goes backwards, forwards, upside down, around and around, depending on where that person is in that continuum. And it's a means to keep a resident thriving in place and staying in their home for as long as possible. It helps us to catch declines early, and it allows us to address any needs before they result in a fall or a hospital stay. So now I'm going to pass it over to Karen and let her talk about some of our clinical programs and how they can assist in preventing declines and helping us be well.
Thanks, Britt.
Yep.
So we're going to go into what we call at Functional Pathways our core 4 clinical programming. And our idea behind this was really about touching every resident and every patient, no matter where they are in that care continuum that Brittany just talked about. So our core 4 clinical programs are really designed to both be a therapeutic approach for the therapy teams, to also be therapy approaches for the nursing team, social services, activities, dietary, whether you're in AL, IL, whether you're in the garden homes, townhomes, whether you're in Ruth's Way, whether you're in the suites at Jordan River, wherever you are, all 4 of these programs can really touch every single resident and patient. Our first one that I'm going to talk to you about is our Be Steady Fall Prevention Program. We know that there's lots and lots of conversation out there about falls, and it is one of the highest risk areas for every one of us if we're over 50, basically. But over half of older adults who fall will fall again within 6 months. That's kind of a scary thing to think about. And then usually there is some kind of history of multiple falls before a resident or patient passes. And we know that more than half of all fatal falls involve people over age 75. So having that fall prevention program and being on the cutting edge of that fall prevention, our program uses technology, it uses training for not only the resident, but the caregivers and the staff, and putting different systems in place to ensure that we reduce and get rid of those falls as much as possible. Falls are the second leading cause of brain and spinal cord injuries, and they're responsible for about 87% of fractures in older adults that are treated in emergency rooms. So we want to try to reduce that as well, because we know that the minute you have a fracture, you have a brain injury, your quality of life is probably going to decrease. Typically, over half of older adults who require surgery to repair a hip fracture due to a fall don't recover to that prior level of function prior to that fall. And they do tend to experience a significant decline in what we talked about around that quality of life. And they are the leading cause of death among people 65 and over in the United States. So we really felt like B-Steady was an important key program for us to really develop for our therapy teams and our client teams to be able to really address this significant issue. There are lots of risk factors that we talk about around fall risk and fall prevention. They're listed here. We can talk about vision problems, weakness, vestibular conditions, lots of different deficiencies, especially when you look at vitamin D. That's been directly linked to increased falls. Home hazards is a big thing. Again, whether you're in the garden home or the townhomes or you're in the suites or wherever you are, you still want to be able to reduce those hazards, and therapy can certainly help you do that. And then also looking at medications across the board. When are we taking the meds? Can we change some of the meds? We know that antipsychotics and antidepressants can increase those risks for falls. So really looking at the holistic approach of the patient. So just a little quick overview of our B-Study, some of the goals and the treatment approaches. Pretty general, but we do spend a lot of time talking about not just the ambulation piece. We want to make sure that the patient is removing that fear of falling. That's probably one of the biggest things. I know when I talk to patients or I talk to physical therapists that are working with patients who are at risk for falls, one of the things the patients say a lot is, I'm so afraid to fall. You know, they don't do things or they're hesitant to do things. And anytime you're afraid of something, it kind of makes you take a little step back and you're not as sure of yourself. And that actually increases that risk of falling. So being able to provide all those treatment approaches to address fear management, to address strength and physical conditioning, all the posture training, energy conservation techniques, we do a lot. We also have a program called Aquaflow, which is our aquatherapy, our I-Chi, which involves getting patients stronger in the water and feeling better in the water before they go on land, to reduce that risk of fall and increase that strength and ability to ambulate a little bit better. So we do want to make sure we're enhancing that quality of life. We're collaborating with everyone that has anything to do with that resident. It goes so much farther beyond just therapy when you talk about fall reduction. It takes every single one of us in the community, whether you're a housekeeper, whether you're maintenance, whether you're dietary, anybody that has eyes on these residents, caregivers, should understand what those risks are and how to be able to effectively reduce those. And that's what our B-Study program really does, is pull everybody in and gives you all the tools that you need to do that appropriate assessment. So I thought this was interesting. Beth Reigert, who is one of our clinical outcome specialists and an OT by trade, has done a lot of work around our B-Study program. And one of our recent clinical reimbursement digests included this learning to fall. And I think it's a really interesting concept and something we can all do, whether we're over 65 or 75 or not. You look at somebody like Tom Brady here, and he has spent time in his career learning how to fall to reduce his injury. And there are certain things that you can do. And those of us on this call can certainly take these, and hopefully we're not going to fall. But if you trip and you trip over your kid or your dog or your cat or whatever it might be in the garage as you're getting your Christmas decorations down or whatever, we can take these things into consideration. And these are some of the things that we can do in the community to reduce that risk of injury. If you're going to fall, okay, well, not okay, but if you're going to fall, we want to make you fall as safely as possible. So just a couple ways to be able to mitigate an injury of fall is make sure that you're protecting your head. It is the most important part of your body. It runs everything that happens in your body. So you always want to make sure that you're turning your body to allow that your back and your rear end take the brunt of it instead of your face or head, right? You don't want to face plant. It's much better to hit yourself on the butt or the back. You want to stay bent too. A lot of times people, I'll see, they'll just kind of straighten up. You want to stay flexible and loose and allow your body to absorb the weight of your body as opposed to staying really stiff and keeping everything bent, so you reduce that risk of fracture. go with the flow. You're not necessarily going to be able to change the momentum of how you're falling. So staying flexible and going with that motion instead of trying to block a motion can actually lead to increased injury. And then falling on your soft spots, wherever those may be. Some of us are a little softer in some areas than others, but usually your butt and your back, your lower back, or the back here of your shoulder is usually softer. So you want to try to fall that direction as much as possible. And this is really just some of the things that we talk about when we go through the B study, whether you're learning it in wellness or whether you're learning it on the SNF side, all important things to be able to reduce that risk of injury and reduce that risk of fall. So our next program in our core 4 is our Pathways to CHI, which is our pain management program. And there's a lot of really cool things in here. Again, Beth Reigard, our occupational therapist, is huge into pain management, has done a lot around our Aquaflow and B study and this Pathways to CHI. And she's really married the Eastern and the Western medicine together to be able to really manage that pain. We know that quality of life can be significantly reduced if you're having any kind of pain. And we know that pain is subjective. What may hurt to you may not hurt nearly as much to me. So we have to take what the patients and the residents are saying and apply all these different medicine styles, whether it's through the Eastern medicine, which is more around the Tai Chi and different visualization and things like that, with the Western medicine to address not only the acute pain, but that chronic pain as well. We chose to do Pathways to CHI because CHI is energy, which provides human bodies with the nutrition, circulation, minerals needed to be able to really thrive. So in traditional Chinese medicine, CHI is referred to a life source and a measurement of their vitality. So we really felt like that was important and really kind of tied into what we were trying to achieve with Pathways to CHI. So just a little quick overview of our Pathways to CHI about pain. Pain is not a normal part of aging. I think a lot of people think that it is, but it is not normal. But yet it's twice as prevalent in older adults. And there have been a couple of studies out there. The most recent one, I think, was about 2 years ago, that show about 24 to 46% of the patients in nursing home settings experience daily pain. Not a good thing. So we've got to figure out a way other than just pharmacologically to address that pain, and Pathways to CHI can definitely help do that. Feeling pain does not necessarily mean that you've had an injury. It could be psychosomatic. There could be lots of different reasons for that pain, and we need to make sure that we're assessing those. And then even though we do talk about prescribing medications, we found that it typically only reduces pain by about 30%. So there's still that extra mile that we have to go to continue to reduce that pain. There's lots of different ways we can do that. We have your manual therapy, we have mind-body approaches, whether you're using guided imagery, yoga, Tai Chi is a great way to do that. And then we also have our Aquaflow or our aquatic therapy, which is fantastic for pain management. I know I've used it myself personally, and it really does make a difference. So just a couple of quick program features. We involve everyone when we talk about pain management, and it's beyond just the therapy team. We got to talk to the pharmacist. We talk about wellness. Activities is huge in being able to help reduce pain. Dietary, looking at different dietary supplements and things that can help reduce that joint pain and the inflammation and things like that. Ensuring that if there's a pain doctor involved, that they're involved in that conversation also. Having an individualized program, teaching the patients and loved ones how to manage that pain, how to work through the pain and what to do to lessen it. And again, incorporating that Eastern and Western, both approaches to be able to be successful, because it really does take everything. And then I did include here the pain scale that we typically use, which is the 1 to 10. And I think sometimes we don't always do a very good job of explaining the pain scale. We just assume that 10 is really terrible. But I think making sure that you understand a 10 really should mean you're completely incapacitated. You can't do anything. And I can tell you, I've talked to patients different times, and they'll say, yeah, my pain's a 10 out of 10. And they're just trucking along beautifully, not, they're able to do everything like they normally do. Again, I know that pain is subjective, but having that conversation when we talk about this pain scale and really explaining, well, A 10 really means you're not doing anything. You got to go straight to the hospital and really working through that. But keeping this in mind when you're assessing your own pain and then when you're talking to others about their pain as well. So the next core 4 is our BREATHE study, which is our cardiopulmonary program. A lot of people think that you would have to have a cardiac or a pulmonary process or disease or debility, and that's not necessarily so. Cardiopulm really applies to every single one of us every single day because we have to breathe and our heart has to beat in order for us to exist. So BREATHE study really fits every single patient that we have. So it does talk about improving that quality of life, whether they have cardiac or pulmonary diseases, but we incorporate this across the board a lot with our patients, whether they have a cardiopulmonary disease or not. It does help reduce the risk of exacerbation of those problems and deficits. We do try to address those impairments associated with that decreased quality of life and especially those functional abilities and try to maintain that independence and quality of life as much as possible. And there is a lot of education and training and exercise skills and different strategies that we provide to the residents and the caregivers to be able to encourage wellness throughout this BREATHE study program. So just a little bit of background and description. There are a lot of overlapping symptoms when you talk about the relationship between the heart and the lungs, which is why we combined this BREATHE study with cardiopulm. It is designed to reduce symptoms and increase that activity level daily and overall function in terms of those pulmonary conditions and talking about strengthening and improving the heart health, both through whether we're talking about exercise, education, lifestyle adjustments, dietary adjustments, those kind of things. There are a couple of disease processes listed here. It's certainly not all inclusive. Like I said, we have the pulmonary and the cardiac conditions listed, but really BREATHE study applies to every single patient that comes in. We know, I don't know that we necessarily think all the time as therapists, especially that when you're debilitated, whether you have a cardiopulmonary disease or not, you're debilitated everywhere. All of your muscles, your diaphragm's debilitated, all of your support muscles are debilitated, your heart's probably more debilitated because it is a muscle. So no matter where you are across that spectrum, really applying the BREATHE study techniques is beneficial. So just a couple of program goals, and I listed here some examples of energy conservation or work simplification, which again can be whether you're talking about wellness, whether you're talking about your the suites at Jordan River or any of your AL/IL patients, outpatient or whatever. These are techniques that you know, a short list that we would potentially implement with the patients, and we can do this. I looked at this list and I'm like, well, shoot, I'm 53 and there's a couple of these things I probably need to do to conserve some of my energy sometimes, even though I'm a go, go, go kind of gal. But gosh, if I can combine a couple things into one, how great would that be and not have to expend energy that I don't necessarily have to. So just a list here around that kind of thing. And then you can see the goals over here about using the energy conservation techniques, increasing that activity tolerance, and being able to participate in daily tasks and those leisure activities. You know, if you want to be able to go out and walk your dog, BREATHE study is a great way to be able to do that. If you have COPD or if you've had a heart attack or something like that, how do we incorporate that into that treatment? We want to minimize those signs and symptoms of pulmonary distress and cardiac distress as well, and provide as much postural and respiratory muscle support as possible, no matter where you are on that spectrum. So our last program then is all about our dementia management and cognition, and it is pathways to engagement. Personally, it's one of my absolute favorite programs. I love working with patients that have a cognitive deficit or dementia. I think there's a lot of things about it that are still misunderstood. I think people don't necessarily realize there are over 130 different dementing diseases. I think most of the time we think about Parkinson's or Lewy body or Alzheimer's or Lewy bodies or those kind of things, but there's really actually over 130 different kinds. So being able to take that the staging process and equate that over to everything we do as caregivers, because Pathways to Engagement is really about how do we as caregivers provide the best communication and the best interaction with the patient so they have success and they keep those functions moving as much as possible, that they keep as much of their independence for as long as possible. And for a patient that has dementia, that really falls to us as the caregivers and the healthcare providers and all of those, because we're the ones that need to have the understanding and then being able to transfer that over to that patient so that they can have some success. So when we talk about Pathways to Engagement, most of what we built around this program is based on Teepa-Snow's GEMS. If you've never had an opportunity to go out and look at her GEMS and her whole philosophy on dementia management, I highly recommend that you do it. It's Teepa Snow. She is amazing. I've had the opportunity to see her in person and chat with her, and Beth Reigart has as well. Just an amazing brain and so passionate about this population, and has done so much research and really come out with a lot of different strategies to be able to be successful. Like I said, dementia is that umbrella term for those 130 plus different dementing diseases. It is not a normal aging process. Currently, there is no cure for the dementias. For most of them, there are some medication-induced ones that you can actually kind of back up a little bit. But when you talk about Alzheimer's and Lewy bodies and Huntington's dementia and those kind of things, there is not a cure. There are medications out there that can slow the process. But, at this point, although we're getting closer to a cure, we're not there yet. Now, Alzheimer's is the most common, and it does account for about 60 to 80% of the dementias out there, although we are seeing some trending, some movement in that number when we talk about the Lewy bodies, which is typically associated with Parkinson's, and also some of the alcohol dementias and those kind of things. It does tend to follow a very predictable progression depending on the cause and the type. For example, Alzheimer's dementia tends to follow a pretty steady, just general decline, and we know how it's going to go. But if you have somebody that has vascular dementia and they have a stroke or they have a TIA, they're going to do okay until they have another incident, and then boom, they're going to drop down. And then they're going to do okay until they have another incident, and then boom, they're going to drop down. And depending where that stroke happens in the brain. But there's lots of different ways to be able to manage that. Our focus really is on the remaining functional abilities that resident and patient have. If they're not able to perform tasks, we either need to retrain the resident where it's possible, or we need to train ourselves and the caregivers to be able to provide whatever cues or strategies or assistance is needed for that resident to be able to get that task complete. So that's really what Pathways to Engagement does, is it walks those caregivers, us as caregivers, through this whole process. There's lots of teaching and training. This is really truly a partnership between therapy and the community staff, because there's lots of different crossover, and it can't just be on therapy. Pathways to CHI is a lot more therapy driven, but Pathways to Engagement, it takes all of us. It takes a village to really be successful in Pathways to Engagement, whether you're doing environmental modifications, whether you're doing teaching and training on the staging for your staff so that they know exactly how to interact with that resident, talking about relaxation and those kind of things. So lots of different education to the community around that. I've listed here the Living Gems, which is Teepa-Snow's positive approach to care. If you're not, like I said, if you're not familiar with these, highly recommend that you go out and look at those. I reference these all the time. And it gives you the different levels of what to expect, what you would see. If somebody's in Diamond, what you would expect to see in that level, and then some caregiver approaches that you can use very, very easily. It's great for your nursing assistants, social workers, caregivers. I've handed this to families on numerous different occasions, and it really does make a difference. So with all of that core four, and every single patient that we touch and every resident that we touch, no matter where they are in that care continuum, we have our own outcomes tool, and it's called RAC-CT. And every single resident and every single client that we have has the ability to go in and see what the outcomes are, no matter what caseload that patient's on, whether they're in the SNF side, if they're in the suites at Jordan River, or whether they're in Ruth's Way, or whether they're in the outpatient setting, in the garden or in the townhomes. either way. We use the software. The families can log in and see how their loved one is doing based on section GG on the MDS. It's different levels of assessing the patient. Talks about bed mobility, toileting, transfers, upper body dressing, lower body dressing, picking stuff off the floor, car transfers, steps, all those kind of things. So anything that's a goal, you'll actually be able to log into our Right Track and be able to see how you're doing, whether it's you as the resident, you as the therapist, or you as the client or the director of nursing, whoever you may be, social work, so that you can plan discharge from therapy, you can plan discharge from the SNF, and really gives you that real-time measurement of how that patient and that resident are doing. And we're fully transparent about that. So the POAs can log in and see how they're doing every single day and help plan that care. And then the last thing I'm going to talk about is we know for sure that we want to avoid the hospital, right? No matter where you are in that care continuum, if we can stay out of the hospital, then let's stay out of the hospital. So we have developed at Functional Pathways what we call our traffic lights. And they're really used for educational tools for our residents and family members and for our staff on the floor to be able to identify those early warning signs. You know, green means good, everything's great, trucking along nicely. Yellow, not so hot, we probably need to do something now. And red is danger, Will Robinson, gotta go. And our goal is to avoid getting to that red. But it allows the resident and the caregivers to really kind of educate themselves on those different disease processes. And we have a library of about 38 of these, I think, based on diagnosis, where you can actually give this to them and they have a tool that they can use to try to keep themselves as healthy as possible, whether you're wellness or SNF, to keep you as healthy as possible and keep you out of the hospital, if at all possible, for any of these disorders or disease process. So with that, I'm going to turn it over to Britt to talk about wellness.
Thank you, Karen. So I think Karen did obviously an awesome job going through our core 4 programs, and kind of, as you guys saw, kind of that overlying theme was that care continuum, and everything she talked about with each of those programs was there was that wellness piece of it, there was the nursing piece of it, there was the therapy piece of it. It all ties together. So in addition to all of those programs and everything she talked about, I'm going to talk about kind of that one step further of the wellness piece and really focusing on what wellness means to you. So, so my screen's over here and I have to look this way. It's throwing me off here. I apologize. So what does wellness mean to each of us? What I personally love about wellness is that it can mean something different to everybody. It's not a one size fits all cookie cutter thing. What we have and what we'll talk about are a lot of different tools and components, and there's tons more out there, but it's really up to you what you do with them. And what we have and what we can do with it really allows us to thrive in place and allows our residents to thrive in place, which is my favorite part. So when we hear the word wellness, I think a lot of us immediately think of exercise classes, which isn't wrong, but there's actually a lot of different components that make up wellness. And by understanding and participating in each of those different kind of dimensions, we can truly make the most out of what a community has to offer and take control of your health and your wellness. So as you can see, this is from the International Council on Active Aging. There are 7 different dimensions of wellness. So you can see up there, they all kind of fit together. And when you have elements of all of those different dimensions, we really have that kind of well-rounded approach. So a wellness program, quote unquote, may not necessarily have all of those things. But when you look at the services offered at Bailey Station, for example, maybe you have spiritual, services, maybe you have social events. Everything that's offered on the campus across the board may fit all those categories. So what we want to encourage is for residents and people on the campus to participate in things to make sure that they're kind of getting all those pieces of the pie so that they really are getting each and every bit that they possibly can. So physical is probably the easiest to mention. It emphasizes strengthening and caring for our body in order to stay as independent as possible. So things like proper nutrition, regular exercise, stress management, and regularly scheduled doctor's appointments would fit into that category. The social component emphasizes social interactions, spending time with family and friends, joining clubs or social group activities. And some things like a group exercise class may hit on a couple things at once. So for example, group exercise is going to hit that physical component and the social. So 2 birds, 1 stone. Spiritual involves finding purpose and meaning in life. So things like meditation, faith-based activities, yoga, Tai Chi, and even experiencing nature. Vocational helps focus on utilizing skills and harnessing passions and strengths to help others. So things like tutoring or mentoring, volunteering, or even caregiving could kind of help meet that need. Emotional focuses on that ability to cope with challenges and deal with feelings in a positive and respectful way. We all deal with challenges and stress in our lives. It's being able to deal with it positively and in a healthy way. So examples might include counseling, stress management, and self-care, which we'll talk about more in a minute, or even attending a support group. Then there's environmental, which really looks at being able to respect our natural resources or to have a strong connection with the environment. So it's simple things like recycling, reusing goods, even taking a walk outside, meditation, or planting a garden. And then lastly, the intellectual component, which focuses on activities that can stimulate and challenge the brain. Again, a lot of what Karen talked about earlier ties into all of these different dimensions through those core 4 programs, and then through simple wellness activities and classes can kind of tie into all of these different dimensions. So when we are developing a program, when we are talking with the residents, making sure that we do have these different elements in what we are providing so that we really can offer that well-rounded approach to wellness. So I definitely want to take a few minutes to talk about mental health as well. As we all know, wellness has a direct correlation with mental health. Mental health definitely ties into well-being, right? Being physically active and exercising, we all know, can reduce anxiety and improve mood, helps to keep those feelings of anxiousness at bay and can release endorphins and all those other feel-good brain chemicals. It can certainly act as a good distraction, and it's a healthy way to cope with things like depression. I know me personally, if I am feeling a little bit overwhelmed or anxious, I can take 5, 10, 15 minutes and get up and take my dog for a walk outside, get a little fresh air, move around a little bit, and it really does help to just kind of clear your mind a little bit. So in addition to wellness benefiting mental health, it can also impact that emotional component. So like we talked about, emotional health can inspire self-care, relaxation, stress reduction, and that development of inner strength. Probably my favorite thing to talk about is self-care. Taking charge of your mind sometimes means making time for that self-care piece. It comes in all forms. So for me personally, I love taking a hot shower, like scalding hot, like probably way too hot. But that's my thing. I like it. Going for a walk, watching your favorite show on Netflix, going to get a pedicure, whatever it might be, taking that time to decompress and really take care of that mental health, taking care of your mental health. There's no perfect recipe for self-care, just like there's no perfect recipe for wellness, because it looks different for every person. But there's many different health benefits to self-care, which includes better sleep, more energy, more independence, and less stress. So again, there's that overlying theme, right? Everything ties together. We take care of our mental health. It bleeds over into our physical health. It bleeds over into our emotional health. And it all kind of ties together into that overall sense of health, well-being, and thriving in place. So on here, I've got kind of, again, just that reminder of having that strong mind-body connection. Once again, this is where wellness comes into play. Karen did talk earlier about having that healthy mind-body connection through some of our programs like Pathways to Engagement. So taking things like meditation, yoga, even different brain games. When we challenge our brain, we're challenging our body. So making sure that we've got that good connection can help us age in place and thrive in place. So I want to take a few minutes and talk about functional fitness testing. So typically, fitness testing is a really great way. If you don't know how to get started, you don't know what comes next. Is it wellness? Is it therapy? Is it home health? You're not really sure. Functional fitness testing is a great way to figure out what next steps should be and how you should measure or how you can measure your success. So a couple examples of fitness testing might be the senior fitness test or a 4-stage balance test. What a fitness test does will assess your baseline, and then we can make recommendations on what might be most appropriate based on where you're at. So it could be therapy, maybe it's home health, maybe it's working one-on-one with a wellness provider for something like personal training, or maybe it's a home exercise program. But how do you know what the next best steps are if you don't know what your baseline is? It's kind of like when you join a new fitness center, they usually have you do some sort of fitness test when you join so they can make a recommendation for exercise class, get you to sign up for personal training. That is beneficial so you know what your baseline is so they can give those personalized recommendations. Same kinds of thought applies here as well. So we have talked about a lot today in a short amount of time. I know I am a fast talker, so I covered a whole lot, and so did Karen. We talked about that care continuum and the services that we can provide no matter where you live, like our outpatient therapy, the skilled nursing, home health, wellness services. Karen spoke about those core 4 clinical programs, talked about wellness and staying mentally and physically strong. It's important to know your resources when it comes to your health and wellness, and how certainly the farms can be your one-stop shop for getting well, being well, and staying well. So I hope you guys learned a lot and benefited from this. And Karen, I don't know if you had anything you wanted to add, but certainly we can open it up for any questions.
Karen, is there anything you'd like to add before I close this out?
I don't think so. I think Britt closed it out very nicely, unless there's any questions or comments.
Do we have any questions? And just a reminder, if you're muted, to unmute. Okay, well, being that there's no questions, I want to thank both Karen and Brittany for being with us today. I'm so excited about the partnership that we have with Functional Pathways, and know that we're going to be through our wellness and our daily lifestyle program, really touching on those 7 dimensions that you talked about, Brittany, in order to bring a all-encompassed programming to the members and residents that we serve. If you are a member of ours and getting ready to move in, we've got lots of wonderful things for you to keep you well and happy and healthy. If you're not a member yet of the farms, please reach out and contact our sales team, because they'd love to tell you more about our continuum. So with that, I'll just thank the group and close out our session today. Have a great day.